So there are some other features, some other aspects of dementia with Lewy bodies that are common enough that they show up in these diagnostic criteria. Those include what are called rapid eye movement sleep behavior disorders. Now, what the heck is that? So almost everybody with dementia with Lewy bodies has experienced this at some point. Well, the patient may not experience it, but their husband or wife knows exactly what this is. In the middle of a dream, you're dreaming about somebody breaking into your house, and most of us, our brains are designed to paralyze the body so that during a dream, your brain can't tell the difference between the fact that this is a dream versus reality. The brain is actually awake, and you can record the fact that the brain is awake with an EEG. You look at the electrical activity in the brain is awake. It's truly experiencing this burglar coming into the house. And your brain is activating your legs to move and your arms to move. Your brain is doing all this stuff. But our brains have developed so that when you're dreaming, your body becomes paralyzed so that you don't actually carry out the things that you're dreaming about. But a patient with Parkinson's disease and dementia with Lewy bodies, that paralysis mechanism doesn't work very well, so that some of those commands to move your arms and move your legs actually make it down to your arms and legs, and you start fighting off the burglar in your sleep. And unfortunately, that's usually your wife or your husband that you start punching and kicking and that kind of stuff. So that's an example of what's meant by a rapid eye movement sleep behavior disorder, a failure of that paralysis mechanism to work in the middle of sleep. And some people think that this actually precedes almost all of the other symptoms of Parkinson's disease by something like a decade on average. So that REM sleep behaviors are actually fairly common out there in the population. And many scientists believe that patients who have that problem will eventually, if they live long enough, go on to get Parkinson's disease or dementia with Lewy bodies, that it's part of a disease spectrum. Sometimes the disease is slow enough so that you end up dying of something else before you ever get the symptoms of Parkinson's or DLB. Another very common feature of dementia with Lewy bodies is severe neuroleptic sensitivity. What does that mean? That means that when a doctor gives you an antipsychotic medicine to try to make those hallucinations go away, you don't do very well with that medicine. You become severely Parkinsonian. All that stiffness and tremor and rigidity becomes severely bad. It's a common side effect of those medicines, but that side effect is amplified tenfold in a patient with dementia with Lewy bodies, so that they often can't tolerate those antipsychotic or neuroleptic medicines very well. And then a final clinical feature has to do with a brain imaging technology where you can, dopamine is a neurotransmitter, it's a chemical in the brain that becomes messed up in both Parkinson's disease and dementia with Lewy bodies. And you can visualize some of the machinery that has to do with regulating dopamine in the brain. And there are differences between normal people and people with the illness in terms of how this machinery looks. So this is just an example of a brain scan for these so-called dopamine transporters. Now this is a normal patient, and you see all these hot spots in what a part of the brain called the basal ganglia, and also down here in a part of the brain called the substantia nigra. So in this particular patient, there are nice bright hot spots where these dopamine transporters are located, and this is a healthy brain. In a patient with dementia with Lewy bodies, you might see a deficit, a reduction in that hotspot signal.